Minute 37 na legislature Guam is back from recess. Welcome back, colleagues, and buenas. Majority Leader, Senator San Augustine, you're recognized.
Thank you, Madam Speaker. Notwithstanding the House rules, I move to go back to motions.
On that motion, is there any objection? Seeing no objection, motion carries. Majority Leader, you are recognized.
Madam Speaker, notwithstanding the House rules, I move to place appointment of Carissa Elaine Pangilinan to serve as the Director of Guam Behavioral Health and Wellness Center at the pleasure of the Governor onto the session agenda.
On that motion, is there any objection? Seeing no objection, that motion carries. Majority Leader, you're recognized.
Madam Speaker, notwithstanding the House rule, I move to place the reappointment of Angela M. Camacho to serve as member of the Guam Ancestral Land Commission for a term of 4 years from date of confirmation onto the session agenda.
On that motion, is there any objection? Seeing no objection, that motion carries. Majority Leader, you are recognized.
Madam Speaker, notwithstanding the House rule, I move to place the reappointment of Louisa M. Westling to serve as member of the Guam Ancestral Land Commission for a term of 4 years from date of confirmation onto the session agenda.
On that motion, is there any objection? Seeing no objection, that motion carries. Majority Leader, you're recognized.
Madam Speaker, notwithstanding the House rule, I move to place the appointment of Therese C. Areola to serve as Director of the Department of Public Health at the pleasure of the Governor onto the session agenda.
On that motion, is there any objection? Seeing no objection, that motion carries. Are there any other motions? If not, we'll move to legislative concurrence.
Majority Leader, you are recognized, Senator San Augustine.
Madam Speaker, we are now at legislative concurrence. Now we will move to the appointment of Carissa Elaine Pangilinan to serve as the Director of Guam Behavioral Health and Wellness Center at the pleasure of Governor.
To the third reading.
To the third reading file, ma'am.
Voting file. On that motion, does anybody wish to speak? If not, are there any objections? Seeing or hearing none, motion carries. Majority Leader, you're recognized, Senator San Augustine.
Madam Speaker, move to place the reappointment of Angela M. Camacho to serve as member of the Guam Ancestral Land Commission for a term of 4 years from the date of confirmation to the third reading file.
To the third reading voting file. On that motion, are there any objections? Seeing or hearing none, motion carries. Majority Leader, Senator San Augustine, you are recognized.
Madam Speaker, I move to place the reappointment of Louisa M. Westling to serve as member of the Guam Ancestral Land Commission for a term of 4 years from date of confirmation to the third reading file.
On that motion for Louisa R. Westling to be on the third reading voting file, seeing and hearing no objections, motion carries. On the Speaker Terlahi.
Madam Speaker, I'd like to move to place the nomination of Teresa C. Areola to serve as Director of the Department of Public Health and Social Services onto the voting file, consistent with the recommendation of the committee. And I'd like to speak on that motion.
I will allow you at this time, Madam Speaker, to speak on the concurrence for Teresa Areola.
I just want to speak on this motion because of the significance of the appointment to Department of Public Health and Social Services and what the Department of Public Health and Social Services is facing today and has faced actually over the years, especially since COVID and everything that they have gone through the recent 4 or 5 years. It's really been tremendous load that the employees have carried. It's been reinventing or an inventing of things that they had never had to do before. And it's, I think, a very tough job. And so we know that this appointee, Teresa Arreola, comes from service as the director of the Guam Behavioral Health and Wellness Center, and I believe she did an excellent job there. And we were able, in the committee report, to include what she had done at behavioral health, including the expansion of services, especially rehab, especially setting up the 988 and other services very much geared to helping the great need of Guam facing suicide and mental health issues. And so I have no doubt that if she puts her mind to it in this job as well, that she will be able to accomplish things for Guam, make us more efficient in our services to the people of Guam. And so I'm very much looking forward to her service. But there are some issues that face the Department of Public Health and Social Services that I think, we are going to need to be collaborative on. We're going to need to be transparent on in order to regain the trust or to gain the trust of the people of Guam in our public health services in all aspects. We know that public health is really the heart of our community's health and illness prevention programs. So because of the pause that had been put on many of these prevention programs during COVID, they are now getting back up to speed and I think doing very well in that regard. And but we have to support each other. So we want to prevent illness in our community as opposed to only treating it. And public health is really our #1 agency to do that. And so we look forward to all the expansion or the more efficient way of delivering this service that the Director Arreola has proposed during their confirmation hearing, and is for the illness prevention programs for Medicaid, MIP, and our health emergency response, of course. They are the lead agency in health emergency responses. She acknowledged, and I'd like to also acknowledge and put on the record that these are the big concerns, I think, that we have found in the last couple years that are almost, I've declared them to be crisis level, but I believe this is where we need to work together. We are at crisis level at CPS. We have an unprecedented amount of children who are in the system, unprecedented amount of services that they require, an unprecedented amount of foster families that we need, or familial placements that we need for these children. We need shelters more than we've ever needed them, and we need our social workers to help us because they are really the only ones who can help us to find placements for these children who are in need. So I have encouraged the director, the acting director, to really pursue the contract for the children's shelter so that for sure we can make sure that our social workers do not have to do double duty up there at the shelter and that they can get back to their #1 duties, which is helping these children, helping these families, and helping them for the long term find steady placements for them. This is a problem that she inherits. She inherits many issues there. This contract has been pending since the shelter opened. And that was several years ago. It was actually opened during COVID. So it had a virtual opening or virtual soft opening. But it's just a procurement thing going back and forth. So in this regard, I very much look forward to the director acting swiftly and ensuring that we have the workers that we need in the place that we need them, particularly in CPS. And I support all the efforts that CPS has made over the years to retain and recruit these very critical social workers. Same thing with the Division of Environmental Health. We've all heard in here, not just because of the schools, but also because of business establishments, restaurants, playgrounds, everything that the Division of Environmental Health has to inspect according to our codes, and that they have to ensure and promise to us, the people of Guam, that these are safe for your children and for your families. And they are also short. They have embarked on recruitment and retention programs at the leadership of Tom Nadeau, and those continue to this day, and the director has pledged to really go and implement those, particularly the recruitment of this type of position starting at the University of Guam and Guam Community Colleges. We are, of course, providing shelters as a government and expanding some of those through the OHAP services, but it looks like from all reports that we are still going to be short. So I very much look forward to the expansion of Guma San Jose or another shelter or additional shelters to expand on places for homelessness or people who have lost their homes temporarily to get back on their feet. All these children's shelter, the women's shelter, and all the court processes that CPS goes through for these children and shelters and the women, and that they can all work together and that we can really expand those services as public health has done over the years for us. I'm also primarily concerned with the status since COVID of community health centers. And we have community health centers board, so my colleagues are familiar with this because we've passed legislation to ensure that the community health centers, which are almost all federally funded, almost 99% federally funded community health centers, that they meet their mission. And that is to be in the communities, providing urgent care, critical care, and really general services, including dentistry, mental health, and many, many services that they are intended to provide. But we have a long way to go in the provision of that, and I believe I've been working closely with the boards on these community health centers. They have been told by their national approving agency, HRSA, that they need to comply. Our enabling legislation for the community health centers is not consistent with what HRSA requires. We are trying to change that. We tried to change that supposedly with the approval of the Director of Department of Public Health, the boards of the community health centers, and this legislature. That bill was vetoed by the governor, and we have been promised some rewrite of it or some further suggestions, but I know that these community health centers take their jobs very seriously. They work very hard. They meet regularly. They are trying to expand services in the northern and the southern community health centers. We've seen the northern gone out for advertisement now. They're going to expand with the grant that they've received. They're going to expand the northern services, and that's based on demand in the northern services clinic. Southern as well is just trying to get up to speed with all the services that it should be providing in the south. And we are still struggling to get physicians, pharmacists, adequate staff, and equipment to maximize the services that these community health centers can provide. After COVID and after the reshuffling of all the offices in the Central Manilao building in 2019, when it was shut down, and everybody vacated and has not been able to go back there since. This has really impacted the community, according to testimony from their head nurses of this who run the Manila or the Central Public Health Clinic. Now, the Central Clinic was not a community health clinic. It was a Department of Public Health and Social Services clinic. And it was very unique. It was the only dentistry on Guam for public health. It had an x-ray, like a brand new x-ray machine at the time, and other things and conveniences for the public that have really been lost. And according to the testimony, services have greatly decreased because of this relocation. So I'm very much hoping that we can address this lack of services to women, pregnant women, the infant mortality rate, by increasing these services. They're critical. They are the ideal across the nation, is to bring the services to every part of your community where they are needed. And according to the nurses and other management staff at the Department of Public Health and Social Services, they believe that the people of Guam found that Manila facility very convenient. So I am hoping that the new director, we discussed this a little bit at the public hearing, and the director has plans to consolidate office spaces of the Department of Public Health and Social Services, and I don't blame her for that. They're all over the place, and she wants them to be together, and I support that. But I asked her that we prioritize first the opening of a clinic in the Central District, particularly Manila. If that building can be reassessed, it's been promised to be assessed for like 3 years now, and it hasn't. It's been closed since 2019, and they've never assessed it for whether we can fix what the problem was, whether there really was a problem, and what can we do to make it better. So no assessment exists to this day, and I asked the director of the Department of Public Works, and he said that RFP is supposed to go out, but that's pretty much the answer that I've been getting for the last couple years. So there seems to be a hesitation to open up this Manila building, or at least to even assess it and see if it's possible that we can put a clinic back in there to service Central Guam, and that we can bring some of the offices back in there to save rent and really for more efficiencies for the patients, and so bring those services that those patients might need at the same time. That's the luxury or the convenience that the managers described in different public hearings that we have had regarding public health. So that's what I'm looking forward to, in addition to all the other improvements that the director is going to bring to public health, and the support for the staff at public health that she's going to bring. I am very much concerned that we bring to the forefront this critical need for central services, central clinical services. It can't be replaced anywhere else. It can't be replaced by ignoring it. Infant mortality means children are dying. Children because they're not receiving adequate health care. The women's rates that they showed, decreasing, the women's care, pregnant women's care, all of it decreasing because of the change in location, because of the change in circumstances, and because of the lack of a central clinic altogether. So I'm very much hoping and putting on the record that I am hoping that this director is going to put that to the forefront of her plans even before anything else, that has to work concurrently. While we work on the northern and the southern community health centers, and we work on the independence of those boards to comply with HRSA, the Central Health Clinic remains under the jurisdiction of the Department of Public Health, unless it's transferred to the community health centers and they have enough monies to fund that. But right now, that's not been the proposal. So I really urge them to prioritize this Central Health Clinic for the people of Guam and for services for those in critical need. And I support this nomination.
Thank you, Speaker. On the motion to place Senator Joanne Brown.
Thank you very much, Madam Speaker, for the opportunity to comment on this nomination. I, along with Senator Tydegui, attended the public hearing for Teresa Ariola's nomination to the Department of Public Health, and certainly we've seen a lot of the work that her and her staff and her deputies were able to accomplish at behavioral health in terms of the improvements and outreach to the community. We also know, Madam Speaker, being on your health committee, and as you just relayed, one of the things we've definitely decreased with regards to service out there to our communities, to those that are actually most in need, with the public health building in Manilo, essentially because of what we understand was an electrical fire. The entire building was vacated, now going on almost 4 years. And as a result of that, which is very strange behavior, you know, when you get damage to a public building, you know, the response that this administration had with regards to that is to simply vacate the building, divide up the staff, divide up the ability to serve the clientele of public health, and leave the building there to deteriorate. And that's certainly one of the questions that we asked Ms. Ariola, and she mentioned, not quite clear, that yes, she wants to consolidate and be able to increase and provide the service, but that issue with regards to the building, obviously, I didn't get a straight answer that she was going to go back and get that building assessed. Yes, we'll get this assessed. I didn't get a sense of urgency. And as a result, what are we doing? We've divided up these services where most of the clients, and we've seen from the presentation made earlier this year by the employees of public health, the employees that work there that are saying, please give us back our building so that we can provide services to our clientele out in the community, those that need our services. And they also, Madam Speaker, as you recall, provided a breakdown of the services that they were able to provide in the past and the decrease in the amount of outreach to help those that really needed these services. And that does not make a lot of sense. And so you got to wonder, as I say, you know, when politics, and I always say there's the good and the bad, but when politics rears its ugly head, and it has reared its ugly head with regards to the maintenance of that facility, because there's no reason that public health leadership could not have gone into that building and assessed whatever the issues were, correct them, and make sure the building was operating. Because right now, and I don't know what the total is, the amount of lease money that's being paid out, even if it's federal money, I don't know if it's local money, federal money, what they might be using to pay for the lease of the different facilities. But as you recall, Madam Speaker, the employees told us, some of them that are, you know, I guess they have their boxes in the same room with them, that they don't have a lot of space because they had to bring all their records and their files with them. But more importantly, they pointed out, we don't in some areas have the space to assist our clients, to provide them the privacy that they need when they come in to see us so that we can help them. And that makes no sense. That makes no sense with an administration that publicly came out, not just when they ran the first time, but when they ran the second time, that health care would be a priority. And I ask yourself, the dear people of Guam out there, ask yourself, are we better off with our health care? Not from the statistics provided by public health themselves, not our information, their information. And as I've mentioned, I've been in a government office that has been burned by a fire, down to nothing but black, walls that totally were destroyed, files, documents, furniture, and the rest of the building was engulfed with smoke and soot. Every surface that had a surface, every computer, every single thing that made that agency operate somehow had to be either replaced, renewed, whatever the case may be. But we did it. It happened in 2015 at the Port Authority of Guam, where interestingly, the Customs Office, we don't hear a lot about that, but that wasn't the only office that they believed of Customs at the time where something kind of funny business happened. But that office and everything adjacent to it, which was the personnel office of the port, burned down to nothing. We had to vacate the building. We had to figure out how to keep the operations going and gut those areas with our insurance company and rebuild it and get back into operation, and we moved on. That, to me, is a normal response. The normal response is not to go and vacate the building and rent everywhere else and not provide the service to the community. This is one area for this administration because time is running out. The clock is ticking. They got 2 more years to go in a few months. And this is not a highlight, especially for those that do not have the ability or may not have the finances to go to a regular doctor to get checked or to get helped, or as you mentioned, our issue with infant mortality on this island for those mothers that may not have the resources to go and get prenatal care. And certainly for everyone who's gone through having a baby or carrying a baby, prenatal care is critical, particularly if there's some health issues for that child or for that mother that's going through that pregnancy. So yeah, how do we brag? We got all this money, but my goodness, where it matters, where we're supposed to service our constituents out there that need the help the most, they're not getting it. And they're not getting it because for the past 4+ years, we do not have a central facility in Mangilo to assist them. And trust me, the explanations are just not strong enough. We heard it was an electrical fire. We heard there was some smoke. We heard there was a little damage. What is in the report from the Guam Fire Department? We need to replace a door. So it makes no sense to say, oh, it's not safe for our people to go in there. It's not safe. Did they fully assess the building? Did they determine what needed to be corrected or improved or rebuilt? My goodness, electrical wiring. We can't redo electrical wiring. We can't redo the entire facility. I remember as a child, Madam Speaker, when I was a student at Price Elementary School, you know, just down the hill, when public health was first open, I think it was about 1972, 1973. I'm dating myself. But it used to be fun for us because we got to go on the bus and we got to go on a field trip. So we could go up to public health so they could assess us and do our dentistry. Not that I didn't have resources to, my dad was still in the Navy at the time, not like I didn't have resources to go to the Navy clinic, but it was fun. Remember our fluoride treatments? They always give us our little cup with our fluoride. It was a field trip so that every student in Price Elementary School got to go to the clinic, got to get their teeth checked, got to get their health care, got to get their shots if by chance mommy and daddy didn't take them to get it. There was such a major move at that time in the early 70s to make sure our children were healthy and make sure our children were safe. Imagine that for children that do not, for whatever reason in their home environment, don't have that support system. At least they wouldn't fall through the cracks. But we got a lot of children, we got a lot of people in our community that are falling through the cracks. Why? Because we're not addressing the renovations and the operation of the public health building. Now some say, oh, it's not habitable. But yet we've got your bill, we've got other bills here to say, oh, well, let's turn it over to GCC. Let's turn it and make it a nursing facility. Well, that would be great if we actually had a central operation for public health. Because we tell people, oh, you can go to the Southern Clinic, oh, you can drive up to Dedido. Maybe easy for those of us that walk out of here and get into our air-conditioned cars or trucks, because we got a lot of trucks. I do. But that's not the case for everybody, because not everybody has transportation or the ability to get transportation, or maybe they can hope there's a friend or relative that can assist them, or maybe the bus system might actually work and get them there in time. But it's a total disservice when we talk about helping and supporting our people in this community that are most in need, when we have the ability to do it, and for whatever reason, because I can only wonder, because public health is supposed to be part of the complex, it would justify it even more, because now public health, there's no central home. Maybe we need to add that to the complex for the medical facility. And so between now and then, what happens? Our people have suffered. Our people continue to suffer. And this is something very tangible. This is not just talk because we're talking. We have public health employees coming and telling us this. Public health employees coming and telling us, we need our building back. And I'm sure, colleagues, if you didn't know that, well, the majority of you are never there for public hearings, so you probably didn't hear it. And they did it defying their own leadership. Hopefully there was no consequence or retribution to them, because boy, that's the way it goes, isn't it? Dare to speak up. And what happens? Oh, maybe all of a sudden you get blacklisted, maybe all of a sudden you're not in the inn, which is not right. Because if something's going wrong in the government, by all means, those of us who know about it should speak up about it and should do something about it. So I'm hopeful. I mean, Ms. Ariola has a very good track record. I give her credit for that. But I have to admit, in this one area, she was never quite clear, other than, oh, we'll assess the building. But I didn't get a real sense that, you know, they're going to put this on the front burner and actually address assessing and moving back into that building. The sad reality, Madam Speaker, is we're probably going to have to wait to whoever, whatever, whomever the next governor of Guam is going to be to actually get that facility operating. Or you get 10 members of the next legislature that are going to vote on an override to mandate that the government reassess and return back to public health. It makes no sense. In this time of plenty, when we've had more money going through the government of Guam, and for you colleagues that voted on that budget bill last week, the largest budget in the history of the government of Guam, and yet the ones that are most in need of the services that we provide as a government, we're falling short. It's hard to brag when there's tangible evidence that we're falling short, especially for those most in need in this community that need the help, that need the services that public health can provide, and they have a difficulty accessing that because the government shut down a main facility in Manilo that they needed to operate out of. And we know on any given day, having gone up there when public health was in operation, it was a very busy place. People were there for all kinds of things, be it their dental, their medical appointment, or they needed to get their marriage license, their birth certificate, their death certificate. It was a busy place to be. And I think we want to see the facility return back to a hub of activity serving our community. So I do support the appointment of Teresa Ariola to be the next Director of Public Health, but I hope she puts it on her agenda. I know it's tough, especially if your governor doesn't support the initiative to actually get that facility assessed and get it refurbished and getting operating again. I think our people deserve a lot more than what we provided for them over the last few years in an area that is most critical. So with that, Madam Speaker, thank you for the opportunity to comment on this nomination.
Senator Brown. On the motion, is there any other person who'd like to be recognized on the motion? If not, then on the motion, Senator Barnett.
Madam Speaker, good morning to my colleagues and to the people of Guam. I'm probably going to support the nomination, but I wasn't encouraged by what I heard from the director in the testimony on the public hearing, only because I've sat through so many hearings as a member of the Committee on Health during my freshman term. And one of the hearings that really stuck out for me was the hearing on the bill to reopen the Manilao Public Health Center. And that was because we had the hardworking employees of the Department of Public Health come out to testify in support of the bill in defiance of the director. The testimony from Nurse Gay and Annette Uggan contradicted the wishes of the administration and the wishes of the then director. And I felt like that was courageous because they didn't do it because of politics. They did it because these career public health, public servants, we talk about service, just getting off the Labor Day weekend, these public servants who do the job know what it takes to get this needed health care out in the community. And these public health, public servants told the senators who were present at the hearing that the closure of the Manilao Clinic and also the way we're running these community health centers is not delivering the best care to our people. Because now that public health has been closed and I drive by this Manilao Clinic twice a day, And I'm hoping now that we're about to confirm Director Ariola, who's married to the Director of Public Works, that maybe we might see a little action on this assessment. Because I drive by this prime piece of real estate that's centrally located that used to be a hub for people who can't afford health care to go to. Even in the Southern Community Health Clinic. Did you know that the Southern Health Clinic was supposed to be an urgent care clinic? Did you know that the care that our people are wanting in a medical complex on the back road to Anderson absolutely could be available at the Public Health Center in Alahan? And a retiring speaker had talked about the politics of it, and I can't think of any other explanation why we would defy common sense and ignore what has worked in the past in favor of what we have today. We had the head nurse who oversees family services programs and expectant mothers tell us in that public hearing that what contributes to infant mortality is a lack of prenatal care. As our island suffers from a shortage of OB-GYNs and a shortage of prenatal care available to expectant mothers, poor expectant mothers, the testimony provided indicated that there was a decrease of 30 to 50% visits from expectant mothers. And so when we close that Magilao Clinic and we cast public health asunder to all parts of the island where now you need 2 full tanks of gas just to run your errand, to go get your food stamp, to go get your immunization, to go here, go there, you're driving around the island 5 times to make to get these services that used to be conveniently available for our island's disadvantaged. We want to talk about helping the poor. And now our idea of public service and public health is to make people jump through all these hoops to get the services that they need. And what is the result of that? Children are dying. Our infant mortality rate for an island that flies under the American flag, it's embarrassing. And we have the career public servants who are the experts in public health telling us exactly why that is. But we have members in here who want to give lip service to supporting the poor, and then they go and they vote against measures that would actually do real things to support poor expectant mothers and to help keep their babies alive. But instead of listening to the experts about how we as a lawmaking body can help save the lives of our children, we close our ears and we proffer these ideas like doulas, when it's very clear what the nurses and the public health experts say will help us save infants' lives. And that is making these services available in the community, making these services convenient. And that's not politics. Those are the facts. And the facts remain that this administration tomorrow can decide to make these services available and convenient, but instead they haven't. And so it's only natural to wonder why. Why? Our island's health care, our people's health care, is in the state it is in, when that was one of the pillars that this administration ran on, right there with fixing the schools. And so, yes, I'm going to raise my hand for Director Ariola, but I really hope that she listens to her employees And I really hope that she looks out across the island and realizes that we need to get these services to the people who need them, the people who deserve them. And that's not coming from this legislature. That's coming from the experts who have been serving the people for decades, who are able to look at how we used to do things, when they worked versus how we're doing things now, when the data and the statistics show that our babies are dying because we can't get the critical services to the mothers and the families that need them. And I feel it in here. We've got colleagues in here rolling their eyes. Oh, why we got to come into a Tuesday and hear all this stuff? Sometimes the truth is uncomfortable. And if you didn't attend the hearing, go back and listen to the hearing and listen to the testimony from the public health employees who, again, in defiance of the politics, came out and provided testimony because they believed it was the best thing for them to do for their patients and for the people that we're all here to serve. So I really hope, and I mean, let's be realistic. A retiring speaker had said it's politics. And yeah, I believe it's the politics of the new hospital. And what it really looks like to me, unfortunately, is that we have this starving of our healthcare system, whether it's GMH or the public health facilities, the clinics, the availabilities of these services. And I just hope it's not intentional, that they're not trying to run GMH into the ground even further. They're not trying to make it impossible for our people to get the public health services they need so that we can decrease our infant mortality rate. If there was ever anything to rally around, that would be it right there. How about we pass bills that decrease our infant mortality rate? Based on what the experts who are out here in the villages trying to get this care to expectant mothers, based on what they say, because they know what works. But instead, what will happen is we're going to close our ears, close our eyes, and pass whatever you have the votes for, as we saw in the budget. So thank you, Madam Speaker, for the opportunity to share my thoughts and also echo the concerns of all the speakers this morning relative to hoping we get this director in there and she does things that benefit the people and not some political agenda. Sijus Masi, Madam Speaker.
Sijus Masi. On the motion, Senator Fisher, you're recognized.
Thank you, ma'am. I definitely support the nomination of Ms. Arreola to become director. I've known her for a number of years. I've seen her in many professional capacities, and I know her to be a person of extraordinary ability to organize and administer large bodies. It's not an easy task. It's often not popular. It is a difficult task, and Ms. Arreola is extraordinarily fit for the duty. So I have every confidence in seeing the Department of Public Health move forward under her leadership. I'm also very much happy to hear from a number of the speakers here. I think I've heard from 3 or 4 people who have begun to speak about infant mortality and maternal mortality on the island. I am very grateful. You know, even though it is an election year, it doesn't matter, just say it. It's a tragedy, and it is a public health emergency. The amount of infant mortality as well as maternal mortality. The legislature, I think, is taking some measures to address this very complex, complicated issue. And me, together with my sister, Senator Tina Rose Munya-Barnes, and my brother, Senator Joe San Augustine, have been working on just such a bill. We heard reference to it earlier, ma'am, the doula bill. The doula bill is designed entirely to address the issue of maternal mortality. As far as I'm aware, this is the first organized attempt, the doula bill, first organized attempt by the legislature to actually step in to do what we can for this tragedy. I think we'll be hearing about the doula bill before the close of this legislature, and I'm hopeful it will pass, and I'm confident, well, I don't want to get ahead of my skis here, but I think Adelup will, in fact, support that. The bill's passage will address issues of postnatal issues with mothers. And by the way, colleagues, maternal mortality is defined as death anytime within a year of the child's birth. Sometimes maternal mortality results from illnesses that may have been, could have been, probably were preventable. And sometimes young mothers, as I have learned, suffer extraordinary depression after the birth of a child, which is not merely sadness, but unfortunately some mothers are driven to suicide by feelings of inadequacy about the way that they are taking care of their children. That's just one facet of this horrendous public health problem, and I'm proud to say that the 37th Guam Legislature is taking steps to do something about it. My brothers and sisters who are supporting me on the doula bill, I thank them and I congratulate them, because they're not merely complaining or pointing a finger at an issue, they're actually addressing it. And that is our job as a legislature, that is our job as individual legislators, to address issues that arise as best we can. One of the issues that we must, you've heard me say it again, I guess I'm one of those people who are always barking about the poor. It's one of those issues that we can take care of and we should take care of. We can and should and must take care of that issue, just as we must take care of the other vulnerable members of our community. So, ma'am, I'd just like to just reiterate my support for Teresa Arreola. I look forward to a vigorous, healthy, proactive Department of Public Health and Social Services under her leadership. Thank you very much, ma'am.
Jesus Masi, Senator. On the motion, Vice Speaker, you're recognized.
Sijus Masi and Manana Sijus, Madam Speaker, thank you for giving me the opportunity to stand and rise in support of the nominee, Teresa Arreola. Having worked with her, I think over 30, with her in the Gutierrez administration, and just seeing the work she's done, it didn't matter what agency you assigned to her, what project you assigned to her, what action item was given to her. Mrs. Arreola had a can-do attitude that she will put her heart and soul into and make sure that that project or that item or that task comes to full success. She definitely is a team player. She definitely brings and includes her employees. She definitely has a vision for seeing the bigger picture. Sometimes we can say that what may have been good back then may not be good today. What may have been back then may be better today. And there are so many other equations that can be put into the presentation that's in front of us today. But I believe in my heart that Teresa Arreola has the experience, she has the heart, she has the capability, and more importantly, she literally has a creative thinking outside the box ideas to get things done, to get things accomplished, but more importantly, to work as a team, to work with teamwork, to bring all the players together, pros and cons, and more importantly, to make sure that she never leaves anybody behind. So I give my 100% support to appointee Teresa Arreola, and hope that my colleagues all support the efforts. I know that the projects that were given, the agencies that she has been given in the past, She's been able to turn them around and come out with flying colors. Most recently, even with her tenure at Department of Behavioral Health and Wellness, she has been able to partner with organizations out there to bring the mission mandates of behavioral health up to the level of an A++ and come out with flying colors. So I just want to say that having been able to work with her on community projects, on nonprofit organizations, community involvement, and even on the campaign trail, Mrs. Teresa Arreola has been one who's literally had a can-do attitude, and I support her efforts. So, Undankala Nasizu Masi, Madam Speaker, for giving me the opportunity to rise in support of her nomination.
Jesus Masi, Vice Speaker. On the motion, is there anyone else who'd like to speak? If not, then is there any objection to the motion to place the nomination in the voting file? Seeing there's no objection, that motion carries. Majority Leader, you are recognized.
Thank you, Madam Speaker. I move to excuse members not present for voting today.
There's a motion to excuse members not present for voting. Is there any objection to that motion? Seeing no objection to that motion carries. All right, we've exhausted our second reading, our legislative concurrence and our second reading. There are no items. So we will proceed to the consideration of the daily file, specifically the voting file of these nominees. If the clerk is ready? Yes? All right, we will proceed. So this nomination will require a roll call. On the nomination, on the appointment of Carissa Elaine Pangilinan to serve as the Director of Guam Behavioral Health and Wellness Center at the pleasure of the Governor. Roll call.
Senator Barnett. Senator Barnett, aye. Senator Blas. Senator Blas, aye. Senator Brown. Senator Brown, aye. Senator Dueñas. Senator Dueñas excused. Senator Fisher. Senator Fisher, aye. Senator Lujan. Senator Lujan, aye. Vice Speaker Muñoz Barnes. Vice Speaker Muñoz Barnes, aye. Senator Parkinson. Senator Parkinson, aye. Senator Perez. Senator Perez, aye. Senator Canata. Senator Canata, aye. Senator San Agustin. Senator San Agustin, aye. Senator Siniclis. Senator Siniclis excuse. Senator Shelton. Senator Shelton excuse. Senator Taitigui. Senator Taitigui excused. Speaker Terlahi. Speaker Terlahi, aye.
On the nomination of Carissa Elaine Pangilinan, she received 11 ayes and 4 excused, and Carissa Elaine Pangilinan is duly confirmed by this body. The next vote will require a show of hands. On the nomination of the reappointment of Angela M. Camacho to serve as a member of the Guam Ancestral Lands Commission for a term of 4 years from the date of confirmation. All in favor, please raise your hands. The nomination of Angela M. Camacho received 11 ayes and 4 excused. Angela M. Camacho is duly confirmed by this body. The next one will also be show of hands. On the nomination of Louisa M. Westling to serve as a member, Guam Ancestral Lands Commission, for a term of 4 years from the date of confirmation. All in favor, please raise your hand. Louisa M. Westling received 11 ayes and 4 excused. Louisa M. Westling is duly confirmed by this body. The next vote will require roll call. The nomination of Teresa C. Arreola to serve as Director of the Department of Public Health and Social Services at the pleasure of the Governor. Roll call.
Senator Barnett. Senator Barnett, aye. Senator Blas. Senator Blas, aye. Senator Brown. Senator Brown, aye. Senator Dueñas. Senator Dueñas excused. Senator Fisher. Senator Fisher, aye. Senator Lujan. Senator Lujan, aye. Vice Speaker Munya Barnes. Vice Speaker Munya Barnes, aye. Senator Parkinson. Senator Parkinson, aye. Senator Perez. Senator Perez, aye. Senator Canata. Senator Canata, aye. Senator San Agustin. Senator San Agustin, aye. Senator San Nicolas. Senator San Nicolas excused. Senator Shelton. Senator Shelton excused. Senator Taitigui. Senator Taitigui excused. Speaker Talahi. Speaker Talahi, aye.
The nomination of Teresa C. Arreola received 11 ayes and 4 excused. Teresa C. Arreola is duly confirmed by the body. That exhausts our consideration of the daily file. Majority Leader, you are recognized.
Madam Speaker, I move to adjourn this session subject to the call of the Speaker.
There's a motion to adjourn subject to call of Speaker. Is there any objection? Seeing no objection, motion carries. We are adjourned subject to the call of the Speaker.